Hi, Merritt. Thanks for joining me today. A lot of people know that February is National Cancer Prevention Month, and it's the perfect moment to talk about how health plans can better engage and encourage members to stay on top of preventive screenings.
Absolutely. Even though screenings save lives, many members still fall behind, and the reasons why are often personal and more varied than plans realize.
That is so true. And you have recently written a blog, and I know in your blog it mentions 5 of the major pitfalls that health plans fall into when they're designing gap in care screening campaigns. So tell me a little bit about the first one. What's the first pitfall?
Sure. The first one is not segmenting on past behavior. So we know that past screening behavior is one of the strongest predictors of future behavior. So people who completed their screenings last year are more likely to complete them this year with minimal outreach. And those who have skipped for a couple years or so, they need a different approach.
Yeah, so what happens when a health plan doesn't segment based on that past behavior?
So they miss an opportunity to use lower cost channels and lower effort to the members who may only need a quick reminder, and then focus those higher cost or more effort on those members who need more support.
That makes sense. Right. Super tactical, but an important one to avoid. So how about the second pitfall, which I see you have said is ignoring channel preference? If members tell us how they want to be contacted, why does that get overlooked?
Sure, yeah. So we've seen a real push in the industry to collect member channel preference. But only in the last few years or so are we seeing plans consistently use members' channel preferences. And I say consistently loosely as well. It varies greatly within organizations by team and by campaigns. So plans often default to what's easiest operationally or what's worked in the past. But honoring those channel preferences matters for results. And that could be calls, it could be SMS, email, portal notifications. All of those are channels that members may choose as their preference. When you message to your members with their preferred channel, it boosts engagement, and we've seen that it can even double program results.
That completely makes sense. I know I like to be communicated the way that I express, so I can understand why this is a pitfall for plans. How about the next one? I was sort of surprised to read in your blog that the next pitfall actually involves incentives. I know everyone loves a gift card, so why are incentives listed as a pitfall?
Yeah, so for annual screenings, they can actually backfire. So incentives tend to spike results once, but then depress future engagement when the reward disappears. So members start waiting for the offer, which can delay care, right? So how many times have you waited to buy something for the holidays because you knew it would be on sale during Black Friday? I know I've done that. So the same applies to healthcare as well. If you know that there's a reward coming, you're going to wait until you see that reward before you do the behavior.
Absolutely. Yep. Again, makes total sense. So let's jump to pitfall 4 here now, which is maybe a little more complicated. It's using one size fits all messaging. And so what happens when a health plan uses the same message and everyone receives that?
Yeah, so it ignores the context. This goes back to segmenting by behavior. Segmenting by behavior, it's a good first step, but then your message needs to match the segment, right? So someone who's usually up to date may only need one reminder with a quick, easy way to schedule to get them to make that do that behavior, schedule a screening. But someone who hasn't screened in years, they may need some barrier specific help, like addressing prep anxiety, cost concerns, or logistical challenges like getting to the actual doctor's office.
So does personalization actually move the needle? Are there some results there that can prove that personalization makes a difference?
Yes, yes. When messages are mapped to specific barriers, we've seen screening completion increase by 30% compared to generic messaging or that one size fits all. So it really absolutely can move the needle.
Yeah, that's a pretty big jump. And then you've got 5 pitfalls here. So the final pitfall, skipping test and learn. Testing sounds pretty simple, but why do plans tend to skip it?
So these campaigns, these screening campaigns, they're routine. They're done every year and they often become set and forget. But revisiting these campaigns with small tests, like even just testing subject lines and emails or the caller voice and an automated outbound call or adding QR codes to your direct mailings with an easy way to schedule, those can lead to massive improvements, right? So one test that we've done showed a 90% increase in screening completion for a segment simply by switching the caller voice that was used.
Wow, that's a big switch just for voice. Interesting. Merritt, what's the bottom line for health plans when looking to increase their cancer screening rates?
Sure. So the biggest mistake is just failing to zoom out. So effective campaigns, they require understanding member behavior, preferences, and motivations, not just a list of who's due for their screening. So plans that can personalize, segment, respect channels, and test continuously, they see better screening rates, and they also see those improved quality scores and ultimately healthier populations.
Got it. So at the end of the day, when health plans build campaigns for sustained engagement, not just quick wins, everybody benefits.
Exactly. And National Cancer Prevention Month is a great reminder of just how important that work really is.
Excellent timing. Thank you, Merritt.
Thanks, Melissa.